I will chair the session on clonal hematopoiesis and multiple myeloma here at the 19th meeting of the IMS. So this is a bit of a niche field and a fairly new field. It talks about a condition where we have two lineages of clonal blood cells in the bone marrow, namely clonal plasma cells, because that's what the meeting is about. We treat and study multiple myeloma, but now we recognize that a fraction of myeloma patients may have clonality of hematopoietic stem cells as well, and this usually is reflected as clonality of the myeloid lineages more than that of the lymphoid lineages where multiple myeloma belongs to. So it's still an open question how the two conditions interact, if they interact in the body of myeloma patients, and whether it is clinically useful to know about clonal hematopoiesis in the context of multiple myeloma. So what we will discuss in this session is the current understanding, and there are so far some signals of impact on survival of patients with clonal hematopoiesis when treated with autologous transplant and maintenance treatment for multiple myeloma. Specifically, it looks as like clonal hematopoiesis is an adverse prognostic factor when patients need treatment for multiple myeloma, and lenalidomide as maintenance may actually counteract this negative prognostic effect of clonal hematopoiesis, which would be a very important take-home message for personalized treatment. Also, there is a question about pathogenesis, as do we think that clonal hematopoiesis, meaning clonal myeloid cells, clonal bone marrow microenvironment, may be a contributing factor towards multiple myeloma pathogenesis, and does this need to be taken into account when it comes to both treatment and MRD monitoring or not? So these are all open questions. As I said, the session is about a fairly new field of research, so there will be more research questions than answers, but this is what we will talk about.